This meeting is being recorded.
Hello and welcome, and I'm really pleased to have Dr. Jennifer Crawley once again talking to us about children's skin. And Jennifer, I can't believe it's a year ago, probably almost to the date.
I know, time flies, time flies.
I know, amazing. Anyway, before we get stuck into talking about children's skin, because I know that we've had some questions in as well, I just want to do a quick shout out to our sponsor, people who've kindly sponsored, is Child's Farm. We worked with them last year. They are brilliant sponsors for our My Eczema Child, I can't even remember what it's called, our support program for children with eczema or eczema prone skin. They're great sponsors, so if you haven't signed up onto the support program, please do, because they also very generously give away freebies, so please sign up. Very quickly, Child's Farm really look to support, and what I like about them is that they are very, very into supporting newborns upwards, very aware, they've been around, very reputable, so please have a look at all the different things they've got, as I said, for newborns, small babies, toddlers, and up towards children, and obviously adults as well. But what we're going to cover here today is very much around the children's side of it. But before we kick on with that, Jennifer, just for people that haven't maybe met you last year, tell us a little bit about you and what you do.
Sure. So thank you so much for having me, especially in a difficult week that it's been for everyone. So I am a consultant dermatologist, and I do both adult and pediatric dermatology. And I also work with Child's Farm to advise them from a science medical point of view. And I work in a University College Hospital, so a large teaching hospital in central London.
Great, thank you. And what Jennifer's referring to is we're recording this, though we're recording it live, the Queen very sadly died last week. And because of that actual reproduction, the repercussions of that is we know that we're having to have there's a funeral, which is a bank holiday, which is the stress that is now, because of the appointments, we're having to make this webinar very short today, but we'll get the main points over rather than me waffling away. So it is going to be a short one because of the bank holiday next week and Jennifer having to fit in all her NHS appointments in double time, which is obviously going to be, it's hard enough anyway for dermatology at the best of times, but even, cutting down a day is stressy, isn't it?
It is, yes.
So what we've agreed to quickly whiz over, or I say whiz over, but to cover today is the hereditary side of eczema. If you've had eczema or eczema prone or sensitive issues with your skin, if you have that as an adult, how likely are you to pass that on to a child? Moving on from that, then look at, also because we're now into September, we're recording this in September, and obviously that's seasons play a significant part in people's skin and how it changes. So we're going to have a look at that. And then at the end of this, we're going to wrap up with Jennifer talking about the major hints and tips of good practice of looking after your skin or your child's skin in particular. So Jennifer, would you like to kick off about the hereditary side? Because I know that a lot of parents are very worried that if they suffered.
Yes, absolutely. Sure. So eczema is a very complex skin condition, and we commonly see it in children and babies because it can take some time for skin to fully mature. And baby skin, is much, much thinner than adult skin. It can take at least 12 to 14 months for skin to mature. So eczema is quite a complex condition, and there definitely are genetic components to it. So we feel that genetically there is a defect in a protein that's very important in skin barrier function called filaggrin, and that can be inherited, and that is the genetic reason or the genetic component of eczema. Obviously, lots of environmental factors play into that as well. So, depending on seasons, irritants, allergens, all of those things then can, those environmental factors can feed into perhaps being genetically predisposed to have eczema, and then, manifest with the clinical signs and symptoms of eczema. Eczema is part of the atopic conditions by which we refer to eczema, asthma and hay fever, and quite often they can run in families as well. So we refer to atopic children or atopic families where, you know, eczema, asthma or hay fever we do see in, you know, parents and children alike. The majority of children, as I say, are prone to a bit of dryness of their skin because their skin is much thinner. However, just to reassure some, you know, parents that the majority of children will grow out of that, you know, once skin barrier function improves, once, you know, the epidermis and the layer becomes much thicker. So, you know, whilst we see it commonly in babies and children, the majority do grow out of that. And again, you know, just as we've talked about before, because genetically, you know, we are worried about that, you know, gene mutation, the filaggrin gene, which stops which is involved in skin barrier. You know, that's why it's so important in all newborns and children to make sure you're helping restore barrier function and keeping the barrier function of the skin so good, you know, by moisturizing on a regular basis, especially coming into the autumn and winter time.
And what's the average age that you would expect to see a child, you know, that the symptoms and flare-ups sort of slowing down?
So normally by the age of 5.
Oh, okay.
Yes, by the age of 5. Obviously, some, you know, babies and children, you will get improvement before then, but the majority of children by around the age of 5, you know, normally you will start to see eczema burn itself out and improve.
And is there anything that, if you've had eczema yourself or you're prone to it, is there anything that you can do for your newborn to start with, or is it just a question of waiting to see if they get it? Or
Sure. Yeah, so really important question. So the main thing you can do is to make sure you are helping with that skin barrier function with lots of moisturizer. So making sure your child's skin does not have the opportunity to dry out and therefore perhaps become a little bit inflamed. So it's important as well that you're not using lots of perfumed or fragranced, you know, products on your child's skin, you know, to make sure that you're avoiding SLS and parabens and some of those nasty potential irritants on the skin. So you want to make sure you're avoiding all of those, bathing your child, and definitely helping with barrier function by moisturizing as often as you can.
And I know this might sound a really stupid question, but if you're the mother and you have highly perfumed body cream and all of those things, by just touching the child, can that make a difference? You know, would it help if you didn't wear those things yourself?
So I suppose not so much, unless obviously, you know, you're breastfeeding and there's, you know, very close skin contact, or, you know, you're using something very perfumed or fragranced on your hands and then, you know, touching your child a lot. But it's mainly for your, you know, your baby or child, just to avoid all of those types of things. And as I say, I know I'm repeating myself, but you cannot over moisturize. So that's the important thing.
And do they know what the percentage of people that who you know, if you've had it as you have it yourself and then your child, what's the percent? Do they know what the percentage is of your child having some problems?
Yes, it's so varied, and again depends on all of those environmental factors as well. So, you know, and that varies with different demographics.
Right. So yes, so then clearly it's a combination of timings and factors and all of those things.
Exactly.
So I mean, moving on then to the fact of the combination of things. So one of them obviously is September, cold weather. And I think what I don't understand is, for some people, when the weather's really good, it's bad for their eczema, and for other people, when it's the reverse.
Yes. So quite rightly, so the majority of eczema is actually flares a little bit more in autumn and winter, with the cold weather, central heating, that very drying environment. You know, going from extremes of temperature, so to a hot, you know, room, to cold outside. So that's when the majority of skin will dry out even more. Even in adult skin, you know, we find autumn and winter, you know, even my own skincare will change for, you know, through seasons. Autumn, winter, you get a bit more dry, so you have to use perhaps thicker creams and ointments compared to the lighter formulation formulations you would use in spring and summer. For some children, quite rightly, you find, especially if they're prone to a bit of hay fever as well, that the pollen, the grasses in summer, can make eczema a little bit worse. But for the majority, it's worse, over winter time. And again, we're coming into autumn and winter, so this is the time to really step up, your moisturizing. Make sure you don't forget about some of those easy to forget areas. So your baby or child's little hands or little feet, ears, and obviously you want to avoid those extremes of temperature as well. So when going outside, make sure, little hands are protected with some gloves, your baby's wearing a little hat, those types of things. Again, just to try and keep all of that lovely moisture locked into the skin.
Well, it's funny, isn't it? Because I was actually going to say, does clothing make a difference? And clearly it does.
Yes. And also the thing that can irritate eczema, a little bit, no matter what time of the year it is, again, thinking about clothing is, those synthetic materials. So, in children it's all, and obviously trying to avoid synthetic materials and, wool and things this time of year. So, best to use cotton materials, cotton fabrics, bedding, cotton sheets, and just to try and avoid, as I say, using anything synthetic or any woolen products that might just cause a wee bit of friction and irritate the skin.
So then I suppose having a vest on is, so if you have a light vest underneath stuff, then you can put the woolies on and all those lovely things.
You can indeed, all those nice things. Yes, you can indeed. Yes.
Really, really important. So, so what I've taken for that really is that, yes, we just need to be aware of the winter, of the changing seasons.
Yes.
Moisturise them more, look maybe at a heavier one, but very much also be aware of what your child is wearing.
Exactly. Yes, absolutely. Yes, absolutely. Absolutely. And also just a point, coming into autumn and winter as well, remember, it's still important, even though we've left our lovely summer days, to make sure we're still aware of using our sunscreen, because, those very sparkling, autumn, winter days when there's bright sunshine, remember, UV can still penetrate even if it's not hot weather. So important as well, just to protect your baby from the, effects of UV, and also for adults as well to continue to wear your sunscreen, if it is a really sunny, bright winter's day.
Definitely. And then lastly, moving on to some of the main big hitters that I know we always say, we know it's all written down there, but we all need to be reminded, don't we, of various things of how best to look after our skin and our children's skin. What would you say are the major things that we should be doing?
Sure. So important. It's, and something, I get asked a lot, even over autumn, winter, is it okay to, to bath my baby, who maybe is a bit dry and a bit sensitive, and that's absolutely fine. We encourage that every day, as long as I say, you're putting something lovely and oily into the bath, so something really hydrating. Important as well, once bathing is finished, not to, dry the skin and cause any friction with rubbing. So I always say, just pat the skin dry, and then apply your moisturizer, but in one downward movement again, so you're avoiding that kind of rubbing up and down in the skin. You're just using in one downward direction. And again, obviously sunscreen, and like we've said, protecting those exposed sites, especially in very cold winter days, hands, feet, wearing a little hat is important as well. But you cannot over moisturize, especially coming into the autumn and winter, and that's where our Child's Farm moisturizer is super, to keep skin well hydrated.
And how much, it's so hard, isn't it, to know how much you're meant to use of a product. Is there a certain amount? Because they never really say on. I'm not saying Child's Farm either say it or don't say it. I just don't, or else I wouldn't read it. How much would you recommend that you use?
Yes. So I always say to parents to make sure you're putting enough moisturizer on the skin, that you're seeing that layer, that sheen of that moisturizer sitting on your child's skin. And again, you cannot over moisturize enough.
Right. Okay. That's really good to know. And I think the other thing is that what we were saying about the bathing is that I know that Child's Farm have a range. It's really important to make sure that you might be moisturizing all the time, but you might then just put some old, supermarket bubble bath in, because it looks nice, it smells nice.
Yes, which don't do. So as I say, avoid anything, heavily kind of fragranced, perfumed, SLS, parabens, and again, just something lovely and oily, and for, specifically for sensitive newborn or baby skin.
Okay. And is there anything else that you think would be important for us to, watch out for? Are there any particular signs which might be red flags that you think, actually, you do need to go and seek professional advice?
Sure. So if when you're doing all of those things and you're moisturizing, your baby regularly, and you find that, their skin is becoming even more dry and importantly red and inflamed with a lot of associated itching, that is the point to seek some medical advice, because even, parents, despite being so diligent and doing all of those wonderful things and looking after, their baby skin, child skin so well, if it does get a bit red and inflamed, you may need some medical treatment for it, and that's why it would be important to seek advice at that time.
So with flare-ups, is it more likely that, because I think that's the term that one would use, is if you
exactly, it is indeed.
As soon as you know that you're going into a flare-up, that's the time at which don't leave it. It's not going to necessarily get better.
Exactly, and sometimes, leaving things, especially anything really skin related, just means it's harder to treat, and sometimes you have to maybe use some stronger topical treatments. So if you find that your child's getting that flare, red, inflamed, uncomfortable, then most definitely, get some prescribed treatment on your baby or child's skin in order to prevent things escalating, and then it's harder to pull back and harder to treat.
And I think quite often it's much easier, isn't it, to when you've got a child, because the child will let you know if it's not happy.
Absolutely.
So
yes, they will. Yes, absolutely. And that is what we want to avoid, that itching, that not sleeping, and your child's miserable. So yes, they will most definitely let you know.
Yeah, and they're not just crying for the sake of it, they're crying it because they're uncomfortable.
Yes.
And then the flip side is for adults as well, isn't it? Because, as adults, you tend to go, oh, I'll just leave it, it will get better. It's the same for an adult. Don't leave it. Go to the doctor as well.
Yes, and get some medical attention if needed, yes.
Well, Jennifer, I know we said it would be really quick, and I think you've answered it with packed in so much really, really quickly.
Yes, we have.
It's really, really interesting, and thank you so much for your time, because I do appreciate it.
Thank you for having me. Thank you so much for having me.
And hopefully we'll see you maybe next year.
Brilliant. Yeah. Look forward to it. The year will fly by again, I am sure.
Thanks very much.
Bye. Thanks so much. Bye.
Bye.